Thinking Aloud. Conversations on the leading edge of knowledge and discovery with psychologist Jeffrey Mishlove.
Hello and welcome. I'm Jeffrey Mishlove. Today we'll be exploring the alternate consciousness paradigm. With me is Dr. Adam Crabtree, who trains psychotherapists at the Center for Training in Psychotherapy in Toronto, Ontario, Canada, where he has a private psychotherapy practice. He is the author or co-author of many books, including From Mesmer to Freud, Magnetic Sleep and the Roots of Psychological Healing. Other titles include his newest book, Evolutionary Love and the Ravages of Greed, Memoirs of a Trance Therapist, and he is also the co-author of a wonderful anthology called Irreducible Mind and co-editor of another wonderful anthology called Beyond Physicalism. Welcome, Adam.
Thank you.
Now, alternate consciousness right away evokes in my mind and probably in the minds of many of our viewers the idea of multiple personalities, which I know is a big interest of yours. But
yes,
when you talk about the alternate consciousness paradigm, you mean something much larger than that.
Much larger, yes. And I am a psychotherapist and have been for many years. And one of the problems that psychotherapy is trying to explain is how is it that an individual finds himself or herself thinking, feeling, or doing things that they don't want to do and don't want to think and don't want to feel.
Yep.
What is the explanation for this? And over the ages, this problem has been solved in different ways. For instance, one of the ways of solving that problem is to say, well, it's a being that comes in me and possesses me, takes hold of me, and I'm thinking and feeling and doing things that I don't want to do because it's not me.
The devil made me do it.
The devil, or maybe I'm cursed. You know, maybe there's some witch that's operating on me or something like that. And this is a way of explaining how this can occur. And as a way of explaining, I call it a paradigm. The explanation is, in my terminology, the intrusion paradigm, where something intrudes into me, affects me, maybe even takes me over, and causes all these effects.
I know these days I hear about many people who believe it's government mind control is affecting them.
Right. Yes, that's right. That'd be a form of the intrusion paradigm.
Right.
Yes. The second paradigm that's also very ancient is that the problem comes from my body, from my physiological functioning. So an old form of it might be the humors, the balance of the humors in my body are not functioning right, so I'm feeling these things, thinking these things, but it's just a physiological effect. And that I call the organic paradigm. It's an organic problem. And we also have that today, by the way, in those who say that all mental illness or some of the main mental illnesses are organic. And should be treated organically.
That's the dominant form of treatment in psychiatry these days. Give them a pill.
Yes, that's right.
Anti-anxiety medications are selling billions of dollars worth every year.
Yes, that's right.
It's enormous.
It is enormous.
And I suppose from the point of view of the medical practice, it makes sense because to the extent that it works, it's quick and efficient. Yes.
And as a matter of fact, there are some things, I believe, that require treatment of a physiological kind or through medication. So even the oldest paradigm, the intrusion paradigm, and the organic paradigm, they exist today, and they might have some validity yet today. It isn't like they're gone now and have no validity. But a very important new paradigm came into being with the discovery of the Marquis de Puységur, who is a follower of Mesmer, Franz Anton Mesmer, the discovery that we have a second self within us that we know nothing about. And that second self can have intentions and ways of seeing life and the world and feeling about things that are very different from our ordinary self,
right.
the first self. And to think that we are divided this way was a brand new idea in 1784 when this was first expressed by the Marquis de Puységur. Very new idea and a very important one because it caused a turn in our understanding of the human psyche that is still with us today, and we find it everywhere in our culture, in our popular understanding of the psyche.
Now, we have done a previous interview on the evolution of psychodynamic theory, which is sort of related to what we're talking about.
It is, because this third paradigm that came into being right then, I call the alternate consciousness paradigm, and it's precisely because Puységur discovered this alternate or other consciousness within people that he was healing that we know about this today.
Well, let's talk about some of the early and even more recent experiments with this alternate consciousness.
Yes, in the earlier experiments with it, they were trying to figure out what the connection might be between our ordinary consciousness and this alternate consciousness. And they were struggling. It was a slow progress that was being made. One of the things that was not known from the beginning was that this alternate consciousness doesn't just come and go when you put a person into this special state called magnetic sleep, or some would call it later on hypnosis. It's there all the time. That was a huge discovery that occurred around 1860 and thereafter, that consciousness is here all the time, therefore affecting us all the time. It doesn't just appear when we're in that special state. So it was important to make that discovery before you could move on to actually carry out an effective psychotherapy in the alternate consciousness paradigm mode.
Well, may I interrupt for a moment and ask you about dreams? I mean, dreams have been known since ancient times. They're not associated with normal waking consciousness, and healers of various kinds have been working with dreams for, going back to biblical times for sure. Isn't that also a form of alternate consciousness?
Well, it definitely is, because that is a sign of life going on outside of our ordinary consciousness. And that life, it may sometimes look a bit bizarre, but it's definitely a mental life. It's definitely an emotional life. So it points us in that same direction.
And I actually heard some people suggest that at some level we are always dreaming, even if we're not conscious of the fact that we are.
Yes, that is said. And I think, from my experience as a psychotherapist, I think there's reason to believe that might be true. Well, one of the aspects of this that I got interested in was the fact that with the discovery of this alternate consciousness paradigm by Puységur in 1784, a new manifestation of emotional illness came into being, which we today call multiple personality disorder. The first one we know of was 1791, 7 years after the discovery of this alternate consciousness paradigm. Before that, if a person had this kind of multiplicity experience, it was experienced as possession, rather than parts of myself manifesting. And it's very strange how from then on, manifestations that we now recognize and call multiple personality, or some form, maybe lesser form of multiple personality, began only after the discovery of the alternate consciousness paradigm. And I have a theory about that. I think that when a person has disturbance, that somehow things are not in balance in them emotionally, it shows itself out here so that people can see it. There are symptoms that we can identify. He can, or she can identify, but people around us can identify. And I think that part of the illness is to communicate with those around us what's going on. So until you have a paradigm by which you can communicate that parts of myself are manifesting here, you have no way to express that to the community except possession.
Now, I know in your work you have worked with possession and you have worked with multiple personality disorder. And if I understand your thinking at this point, these are two very real and distinct conditions.
Yes. For me, they are phenomenologically manifest distinctly. With multiple personality, the different personalities ordinarily identify the fact that they are part of this individual's history. They didn't exist before this individual's whose body they are involved with came into being. And the individual, when you do therapy, can discover places where these different personalities began their function, and some of the reasons about why they began those to
So they're clearly what we would call intrapsychic.
Yes, completely intrapsychic. Now, possession is very different phenomenologically, because what is manifesting, the different personalities, you might say, or one different personality at least, claims to have another history, not the history in this body.
Right.
This body is almost incidental. This individual, they had a history elsewhere. It might be a history of another lifetime, like a human history in another lifetime. It might be a history as a other kind of being, like a demon or something like that. Or it might be a different sort of history where they were attached to another host in elsewhere. But it has this very definite quality of another history is involved, or various histories are involved besides this individual.
And of course, before we had the alternate consciousness paradigm, if a person were a multiple, the only way it could have been interpreted was in terms of possession.
That's exactly right.
But I would think the other way around could also occur after we began to recognize multiple personalities, that it might be the case that someone suffering from possession would have been identified as having a psychopathology rather than an intrusion.
Very definitely. Since we have the alternate consciousness paradigm available now for explanation, some people are going to look at a possession situation and say, I can explain that in terms of alternate consciousness, not in terms of intrusion from the outside of some other entities or beings.
Because of perhaps what we might say of their metaphysical preference.
Yes, that's right. And that's very difficult to refute. I mean, you can have debates about that. And inconclusive debates about what's going on with regard to any particular
But you, as you said, you regard these as two very distinct conditions.
I regard them as very distinct explanations, and the two conditions then correspondingly are different too, yes. Now, I have to make a qualification, however, about this. I said that here is the phenomenology of the multiple personality. But you see, there are some subtleties here. Eve, Three Faces of Eve.
Very famous case.
Very famous case. Chris Sizemore that's her actual name, Eve's actual name. She and I were acquainted, we were friends. And she, from the beginning, believed that one of her three original personalities, Eve Black, was a past life personality. Okay, now that just throws a monkey wrench in my phenomenology here. She only said that about a couple of her personalities. In our conversations, it was Eve Black and someone else. Now, and she wrote about this in her book called not I'm Eve, it's A Mind of My Own. She had a second book, A Mind of My Own.
It's a fascinating case because of the sequel.
Yes, exactly. That's right. So the phenomenology, it's nice to simplify, but you also have to be ready for what the facts are. If the facts say, well, it's not so simple, you got to accept that too.
Well, as a professional psychotherapist, you've now introduced the concept of reincarnation, and I think, if I understand your work, it's fair to say that you consider the research in reincarnation at the University of Virginia to be something that psychotherapists need to take seriously.
Yes, I think it at least has to be studied and considered a possibility, because the evidence that they have at the University of Virginia is massive, and in some cases so convincing. It's hard to explain it any other way except as a past life entity, you might say, or person manifesting in a present life.
So when we talk about the alternate consciousness paradigm, in your view, it's not to the exclusion of either the intrusion paradigm or the physiological paradigm. All of these things can be happening at once, including reincarnation.
Absolutely. And that shows the richness of the human being, the richness of the human psyche. I think one of the challenges of a psychotherapist is to accept the fact that the individual who is there for help is much richer and deeper and more mysterious than we can ever fathom. And the little that we can help them has to do with their using their own inner knowledge and following that for healing, for understanding what's going on with them and healing. Because we couldn't ever do that job by analysis and systems of psychology. They're completely inadequate to describe the richness of individuals.
But I guess it's fair to say that the alternate consciousness paradigm is really the foundation of the modern psychotherapy movement, whether you're a psychodynamic therapist or a depth psychologist or even a cognitive psychologist.
Well, I think the cognitive people have stayed away from that if they could, but as far as I can see, they make use of some aspects of that concept, yes. And behaviorists who are purely behaviorists probably don't see it that way. But it certainly has taken over large segments of psychotherapy and infiltrated into these other segments.
So for our viewers at this point, the alternate consciousness paradigm suggests that for anyone viewing this interview, there's a certain depth within them of which they are not conscious.
Yes, absolutely. And exploring that depth and respecting that depth and listening to the messages and wisdom that comes from that depth is a central part of what psychotherapy is.
Well, Adam Crabtree, once again, we've uncovered a fascinating area of human psychology, and one that is important as it is because of the trends in modern society towards quick fixes, often gets ignored.
Yes, that's true. Yes.
Thank you so much for being with me.
Well, I'm glad to be here, and thank you for asking me.
And thank you for being with us.
Thank you.